there'll be a lot of parents watching this who might have a 5 or 6-year-old child, and they are thinking, do you know what? Something's not quite right. What do you think, if you were a parent, or advising a parent, what were the kind of things you want to look out for when you're dealing with a very young child?
The sorts of things that we find parents are picking up on and which they need to look for is very much around the social development of the child. So they may find that there are differences in the way their child is playing. They may not have developed the skills to actually play with other children, or they may be attempting to play with other children, but it's going wrong. And they may find their child is lashing out or becoming distressed or upset. They may find that play has become very insular, so that the child will just play by themselves. It may be very repetitive, and it may lack imagination. So rather than play with an aeroplane as an aeroplane, they may find that their child is just looking at the physical attributes of the aeroplane and spinning the wheels, or wanting to line up their toys and that sort of thing. They may find their language is of concern. It may be developing, they may be establishing a vocabulary of words, but actually not holding real conversations. Or if their child is talking, they may just be talking about the things that interest the child and doing what we call talking at you rather than talking with you. And they may find they can't take their child to certain environments, supermarkets, for example, or nursery. They may find the environments too busy, too noisy, too unpredictable. And the child may be having what we call meltdowns, where they just fall apart and end up screaming, crying. They may be aggressive, they may be hitting, kicking, punching, etc. And then they may have sensory issues, so they may not be able to tolerate certain things like certain clothes, or having their teeth brushed, or being washed, or certain foods, etc. They may want to always have their clothes off rather than their clothes on. And the parents will pick up on a number of these things and start to become a little bit unsettled and looking around at other children and thinking, well, why isn't my child doing that? And that will lead them then to sort of wonder, who can I go to talk about this?
Well, thank you. And also, I suppose, how difficult is it to Juanita to differentiate autism from what would otherwise might be a speech and language problem or selective mutism, that kind of thing?
It's a really helpful question because it can be very difficult. And it's often one of the first things that as a team we will look at. What I want to say at this point is that sort of decision doesn't simply sit with one person, because part of the challenge in a differential diagnosis is seeking the views of multiple individuals who interact with that child and seeing the child in different environments, or at least gaining information on the child or young person from differing points of view. So we can have, say in the case of a young person who's presenting as selectively mute, that they might only present in that way within a school environment, but within their home context, they can be rather communicative. And so are we looking at selective mutism, or are we looking at a child who is highly anxious within a school context and controls that by not speaking? So the two are slightly different. I think in terms of our clinical practice, what we tend to do is attempt to gain assessment information on the child. So we want to look to see what their language skills are. Is there a difficulty there with language that's impacting upon their ability to communicate? And we would use a wide range of informal and formal measures to do that. We would also want to ascertain, as I've just highlighted, if the child is suffering from any particular anxiety in any given context that might be contributing to to their difficulties in using their language appropriately. And I think we also spend time just wanting to understand a little bit about the personality of the child. We see various children who come into the clinic who we are sometimes told are selectively mute, but these are very passive, quiet children who would rather say nothing at all than potentially say the wrong thing because they don't want to be poorly judged by their peers. So the nuances are very, very subtle. And so the diagnoses can be extremely challenging.
Do you say that there's an importance then placed upon a thorough standardised assessment, or can you do this more sort of broadly?
I think it's a combination of both. I think when we're looking at language, we need to actually understand the skills that the child or young person has, as well as the weaknesses in their profile. So I think that it's good clinical practice for any practitioner to want to have some form of assessment, because that guides so much of what we do. And yes, a great deal of that may well be standardised, but we can look more generally, more informally, to see how that child or young person is presenting.
Would you think that many parents watching this might say, well, actually, do you know what, a speech therapist that's been commissioned by the NHS Trust has simply just contacted me and said, well, you know, my child's got, no, it hasn't got autism, because from a broad evaluation, just looking at the, watching the child in a school or something without doing a full standardised assessment?
I think that we face certain challenges at the moment, given the pandemic and the impact that has upon our ability to assess. But I think there are always things that we can do, and it would be, I think, perhaps not particularly wise to simply take that broad view. I think you have to gather information from a range of sources. You have to try, where possible, to observe the child in different environments, as I was describing before you make that type of decision. And I think every opportunity should be taken, where at all possible, to gather some information, some standardized information on the child if you can. We are very fortunate within the speech and language therapy world, because quite a lot of our assessments translate very nicely, we have since discovered, to being undertaken remotely. So there are things that we can do.
When is a communication difficulty or a language difficulty just that and not autism? When do you cross that threshold into autism?
Well, one of the key differences will be in the use of language. So we call that looking at the pragmatics, and also in the way in which that child uses their language to interact with others or not. So you can have a child who has significant speech and language difficulties. So they might have minimal language. In fact, they might even be non-verbal, but they are genuinely interested in interacting with others and are highly socially motivated, and they seek those sorts of interactions readily, spontaneously, volitionally, and they enjoy them. They really want to do that.
That's not so easy for a young child, is it? Because they might not have developed the sort of the higher ordered language that you would expect of a typical teenager, let's say. But how does that bring challenges when for parents watching this? We're dealing with very young children. How do you actually say that child has got an autism as opposed to a language difficulty or a standalone disorder?
Well, again, it's looking at the way in which that child's language and interaction have developed over time. It might be, and we often see this, and I'm sure there are many parents out who are watching this who can relate to this comment, their child might appear to be socially active and socially interested, but only ever wants to talk to an individual about the same thing over and over and over again, or wants them to do the same thing over and over and over again. Well, that goes outside of the norm of social behaviour. The child isn't necessarily changing and adapting, and these things are very subtle, but children learn to do them without even thinking.
But that's not really based, is it, on a standardised evaluation process? Is that something you do by asking parents to fill out a questionnaire, or is that something you do with a clinical, a proper clinical assessment, standardised assessment?
Some of that can be done in terms of more of your sort of balanced questionnaires, if you like. And so there will be a combination of sending out questionnaires to parents, to nurseries, to schools, to get their views of that child in those particular contexts. But then there's also, if you go along for an assessment, the clinical observation. And when we're assessing for a child who we feel may be somewhere on the autistic spectrum, we're looking very closely at that. We're looking at the way that the child interacts or doesn't, as the case may be. We're looking to see what sort of social rapport we're able to build up with the child or not. We're also looking in a lot of detail at the way in which they play and how they include others in their play. And are they creative in that means or not? So again, it's an amalgamation of all of the above, I would say.
Melinda, there will be certain things that you might look out for and to contribute to on an autism assessment.
Thank you. So usually the multidisciplinary team, it's not always that an OT is in that team, and I receive referrals when the team has concerns about a child's sensory difficulties. Sensory processing difficulties are part of the diagnostic criteria now, and the other professionals do have a certain level of skill to identify whether they have sensory difficulties, but really to break that down and to conduct the more standardised assessment for sensory difficulties is the job of the OT. So we usually I would see a child in their functional environment, pandemic permitting, of course, and that's been really hard at the moment. But it's really important to see children in their natural environment, whether it's school or home, and see how they manage that area. Being in a clinic can be really different, and we may have all of the equipment available for them, but sometimes we really do need to add to that with an observation in a natural environment. And at the moment, I am doing a lot of those virtually, so it's not something that can't be done, but it's always great when we can be there. We might do standardized assessments, things like the sensory integration and praxis test, which is probably the most well-known one. But for myself, I would always be complementing that with a real developmental type assessment. Something the Miller functional and participation scales, the Brunics, the movement ABC are ones that parents have probably heard or professionals have done with their children, but also really gathering the view of the school, the nursery, the home, and also the young person themselves. So there are a number of standardized questionnaires. And a lot of young people are really well able to verbalise what their difficulties are and how it affects them. So their view absolutely must be gained throughout the assessment process.
Melinda, at what point do you say that a child that you might be evaluating, or even an adult who you might be evaluating, would you say crosses the threshold into having hyper or hypersensory sensitivities, which is what the NICE guidelines referred to?
For me, using the standardised questionnaires really are the tools that break that down for us. They've been developed over many years, and they really do give an excellent profile. But I always ask parents and a young person to add additional information into that, because they are just specific questions. And for those of us in other countries, the most common ones are developed in America. So it's really important to put that into the person's life. Now, if someone does really meet the criteria that they have hypersensitivity or hypo, to me, it's the degree to which it affects their ability to engage in life, in functional activities. And if it's impacting on that, then we do know that it is a problem.